Welcome to my healing rooms. I'm here with Dr. Shealy, one of a kind, medical doctor, neurosurgeon, professor of energy medicine, really a pioneer in energy medicine and healing, bringing the Eastern and Western together, which is something we need to do because our current system is really not working all that well. Norm has a weekly call-in radio show, an email newsletter with incredible information. I highly recommend you to sign up for that. And I'm just thrilled to be here with you.
Great to have you, Barbara.
Really happy to be here. And what I want to ask you now is, well, first of all, you had a pain management center.
Right.
And it was 85% effective for the people that you treated.
Yes.
And why are there not more of those centers, and how do we bring all of your knowledge to the public so we can heal a little bit more gently?
Well, for the last 100 years, medicine in this country has been dominated by drugs primarily and surgery secondarily. And when the FDA finally allowed the pharmacomafia to advertise on television, I think that threw us about 30 years ago into an even worse state than ever. The average physician doesn't understand most drugs, let alone the average layperson being told about it on television. I think that was one of the great mistakes. Actually, the biggest mistake was getting the government into medicine at all. Back in 1963, I wrote to President Johnson when they were beginning the debate on Medicare, and I said, look, you are about to bankrupt the country. The government has never been able to do anything that is financially sound. I was on the faculty at Western Reserve Medical School. 1 week later, I got a phone call from the chairman of surgery. He said, Norm, what the hell did you write to President Johnson? I've been on the phone with the FBI all day. They want me to fire you. They spent a week trying to get me fired because I was a communist. Medical expenses in 1965, when it finally was passed, were 4.5% of gross national product. By 1970, they were 12%. I suspect that in 2015, they'll be 20% or more. And we're not as healthy now as we were in 1965. And largely that is because of government nonsense. So the average physician has been brainwashed since going to medical school that the cure is drugs or sometimes surgery. That's it. When I started in 1978, the American Holistic Medical Association, I went to a number of medical schools by invitation, speak to medical students. About 1/3 of the freshmen were interested in holistic medicine. By the time they graduate, it's down to 10%. By the time they finish their residency, it's down to 1%. Interestingly, the American Holistic Medical Association, which was founded in 1978, this very year came to the conclusion that holistic is never going to be accepted by the establishment. Now, I can't say for the public what I'd like to say about the establishment, but basically the establishment is the problem, it is not the solution. So they got rid of the word holistic even in the organization. They became an academy of alternative, integrative medicine. Well, integrative medicine, in my opinion, could be a good concept, but it's been ruined already by the establishment. Hospitals, they went from, holistic to complementary, alternative, integrative bullshit. What else can I say?
Say it, Norm.
And the hospitals have ruined it by offering one or two little things and calling it integrative medicine. Therefore, next month, with 3 other physician friends of mine, we are starting the National Institute of Holistic Medicine.
Yay, that's wonderful. Where? Here?
Right here in Springfield, Mo, with a internationally known cardiologist, an internationally known migraine specialist and his assistant physician or associate physician, and I'm actually going to
You're going to be on staff.
start again with pain and depression.
Yay! So people can come here. You're going to have to fly out here, folks. It's
Well-
one of the few places where they can be treated
Comprehensively.
comprehensively.
Let me tell you about
We're not
cardiology.
throwing out Western medicine.
Of course not. For acute illnesses, I would say, get conventional medicine. It can save your life. But once it becomes chronic, and chronic, depending on what the illness is, to me, is something that's not cured within 1 to 6 months. If it's not cured by the conventional situation, it ain't gonna be. And it's likely to be made worse, in my opinion. One of the reasons that I went out on a twig originally was in neurosurgery. For chronic pain, we had 2 big treatments. To cut the spinal cord, the front half of it, barbarian to say the least, or to destroy the frontal lobes and the personality. Didn't get rid of the pain, but it got rid of their complaint. And that's why I started looking for alternatives to chronic pain. And of course, what I learned early is that 100% of the people were depressed. Many of them before they developed chronic pain, but certainly by the time you've had 5 or 6 unsuccessful operations and crummy drugs, anybody will become depressed.
But you also say depression is synonymous usually with pain. Like, what comes first? Or
Well, many people were, let us say, not necessarily clinically depressed, but what I call subclinically depressed. And then something happens and they get pain and they don't recover.
right.
They didn't have the inner strength to overcome it. But they're made worse then if they're operated multiple times or if they put on narcotics and tranquilizers and other junk drugs. So that my work from 1971 until I closed my clinic 11 years ago was for that kind of person. And I worked with 30,268 people.
Amazing stories. People recovered off their medications, that you
Yes.
gave them their life back.
I helped them get their life back.
Right.
That's
Good
more
correction.
important.
You helped them, you empowered them.
Exactly.
But they didn't know that they had options before coming to you.
Exactly.
People don't know. I didn't know. This is a big
It's
thing.
so important. But so one of the things that sparked my willingness to go back to the clinical world again was meeting this cardiologist, Roy Halbrun. He was one of the principal investigators on the $31 million NIH experiment on chelation. Now, chelation has been around for 60 years,
Right.
not accepted by the medical profession. Chelation is significantly better for saving your life than coronary bypass surgery.
Really?
In fact, coronary bypass surgery does very little except get rid of angina pectoris. The reason I think it gets rid of angina pectoris, it probably destroys the nerve supply to the heart when they're in there.
Why chelation, though? Is it the metals that are causing issues, or what?
Toxic metals damage the arteries, calcium deposits, and it lasts a long time. You know that 1/3 of coronary bypass surgeries patients are closed off within a year. Almost 100% have brain damage from being on a pump, et cetera, et cetera. There are so many alternatives that Roy has taught me. I mean, I'm not into cardiology because as a neurosurgeon, I didn't want to go there. The cardiology is the cash cow of medicine today other than chemotherapy.
One of them, right.
And yet, the test that should be done is a CAT scan of the heart. Nationally, the cost is from $50 to $600. In Springfield, one hospital is $99, one's $400. Same little test. It's all you need to know whether you need to worry about your heart. If there's calcium in the arteries, you need to do something about it. Coronary bypass surgery doesn't touch the calcium, it just puts an extra blood vessel there, which is going to close off in a year most of the time, or a good part of the time. You can clear that with chelation. But there are two other approaches that you can also use. One is compression of the lower half of the body, vigorous compression, external compression. It activates your stem cells. They get in there and clean out the arteries, so you can reverse coronary artery disease. Let's say it might cost you with chelation and that, might cost you $25,000. Coronary bypass, coronary bypass surgery is $100,000 to $150,000 for a procedure that damages your brain.
Right.
So,
now that can that also work for other things? The compression, is that also, if it's stimulating stem cells, it could also be good for your immune system?
it's good for everything.
Wow. So
In
here
general.
we go. Here's another incredible.
Well, there's another one
possibility.
that I added also recently myself, and we also add for people with coronary, and that is exercise with oxygen therapy. Now, I've used exercise with oxygen therapy for 15 years, but not like this. It's 100 liters per minute at 100% oxygen.
Usually it's 10 or 20. Wow.
Right, with vigorous physical exercise.
Even if you have a heart condition, you would
You start
have people
off
do
with
it
that
slowly?
while you're doing the other chelation and the external compression.
How big is your space here? Because when people hear about this, they're going to have a long waiting list.
A large,
Wow.
twice the size of this building.
But see,
in
this
town.
is what I'm talking, this is options. People need to hear about
Exactly.
this. This is so important.
Migraine, Roger Cady, a long-standing friend of mine, is one of the world experts on that, and Kent Dexter, who works with him. So we've got that, we've got the cardiac thing.
So
and
how
then-
would you go in from treat migraines differently than medication? Just a couple of examples.
Oh, there are all kinds of things. Temperature biofeedback is one of the best.
Is that
I
the air
have
bliss?
scores of people who are curing their migraines with this.
And we're going to get to this. This is pretty incredible and easy, non-invasive.
So there's just dozens of alternatives, scores of alternatives for everything. Actually, in my opinion, somewhere between 40 and 80% of people have a problem that precedes everything else. About 40% of people are clinically depressed all of their life. Another 40% have what I call a subclinical depressive miasma. They're not officially clinically depressed, they're that far from it.
Right.
Those people are sitting ducks for every known illness.
Why are so many people, though, with this
Ah.
miasma? What is going on with this?
That one's easy now.
DHE?
Now, only in the last 4 years have I understood this.
Okay.
In April of 2011, a wonderful book came out. I think it came out on the 19th of April, at least the New York Times had it, called The Longevity Project. It's the longest scientific research project that I know, 80 years. Starting in 1921, a psychologist in San Diego asked teachers to provide him with the names of their best students, just best students, 1,500. These kids were studied essentially annually for 80 years. 2 other teams had to take over because he died in the 50s, and it took them another 10 years once they finished the project to analyze all the data. The single number one determinant of how long you're going to live, how healthy you're going to be, and how much money you're going to make throughout your life is conscientiousness. There are lots of personality traits, but conscientiousness is the determinant.
Explain that. What's the definition of conscientiousness?
Organized and responsible. There are all kinds of sub-definitions, but the number one thing is to be a responsible, organized person.
And then can you elaborate on that? What does that mean? I mean, that could have so many meanings.
Well, it means that you, number one, if you're responsible, you take care of yourself first. You don't have unhealthy habits. You don't take as many risks. And you're not sloppy in anything.
It's responsibility.
It's responsibility, being responsible for yourself, and that then gives you room to help other people.
So it's self-care, putting on the air mask first, which is really respecting your divinity,
Exactly.
which is so important.
So important. Now, so once I read that book, I suddenly do, wow, I bet it's oxytocin deficiency. That came to me just like that. It took me hours to put it all together. But here is the situation. If a pregnancy is unwanted, the woman does not produce oxytocin during the 9 months. Or at delivery, which is the big time. 40% of children today are out of wedlock. And you can't convince me that those 40% of women wanted to be pregnant. If she's put to sleep for whatever reason, good or otherwise, and that's about 25% of the time, she doesn't produce the big burst of oxytocin during delivery. So it's what I call oxytocin grounding did not occur. Even if the pregnancy and the delivery are perfect, if there is a major trauma in the first 7 years of life,
It's all over.
any kind of major trauma,
Yeah.
and of course, what's the most common one? Divorce. Not always in the first 7 years of life, but many of my patients have told me they've never been happy. And so, I believe...
Can that be remedied?
Ah.
Is there hope for that?
Well, interestingly, when I just, kept doing my research now 4 years ago, I found that every known psychological emotional disorder, anxiety, depression, autism, ADHD, borderline personality, inadequate personality, schizophrenia, is associated with low levels of oxytocin, which have been treated in small studies with intranasal sprays of oxytocin. It works, but they're no long-term studies. They're mostly weeks.
Can you get
most.
that? Can people...
Yes, but it's expensive.
Right.
And you start spraying your nose with anything 4 times a day, I think it's going to kill your nasal mucosa. That's when I discovered, intuitively,
Listen to this, guys.
air bliss.
So this was intuitively, you received information.
Yeah. All of my inventions have been what I call downloads from guys. And this particular one, I didn't realize when I was so eager to get oxytocin, I made this one and I just called it Bliss at first because I thought, well, this is the big one. 80% of people with anxiety or depression improve strikingly with this.
80%. And you've done studies. This is not a woo-woo thing. It
was presented at the Southern Medical Association National Meeting this year.
And let me tell you how easy this is, because I do it. You put it on, where you can talk about that, certain specific meridian points on your body.
Exactly. It takes 30 seconds once you learn the points. And to me, of all the things that I've discovered in the last 50 years, this is the most important because of that. Because it raises oxytocin. For instance, in June of this year, when I was beginning another study, one man, adult, in his 50s, had an oxytocin blood level of 0.
So you can measure it.
Oh, yes. 30 minutes later, after putting this on, his oxytocin was 10.6. The normal range is 5 to 18.
And this is all these kids, by the way, who probably have all these experiences that are taking the oxycodone, that are taking all these drugs.
Yeah.
Would be a lot better off with this.
Okay, I can give you 2 of my favorite examples. One's a 12-year-old kid with autism. I couldn't get this close to him. 3 feet was the closest I could get. Did an hour with him and his parents. 2 months later, he came in and hugged me. A veteran with a 10-year history of severe post-traumatic stress disorder. The first night he used this, he slept without a nightmare. He has now been 2.5 years, and I hear from him at least every 2 weeks now how well he's doing.
This is a roll-on. This literally, I do it, it takes 30 seconds. It's that easy. I have a question though. I've been told that post-traumatic stress is in the energy in your body. Do you feel the oxytocin? Do you feel that this helps to release the cellular memory of the PTSD?
Yes, it calms down the anxiety, the agitation, because oxytocin is a calming, feel-good chemical.
So what you're saying is that there can be early trauma, and that really does result in people being anxious or depressed or self-esteem. It's everything. It's your whole being.
And all of the physiological and ultimately physical illnesses that come from excess agitation.
Right. So now I'm going to go into the oils, but first I'm going to say we are mind, body, soul. We cannot separate one from the other.
No.
And when the medical establishment, when we separate our body from our soul, which is what all the commercials and all the advertisements, there's a disconnect. So this is, and a lot of the things you do, it's how do we address these souls in this body cohesively, synchronistically. And so I'd love you to talk about that and also about the oils.
I'm just putting the finishing touches on my next book, number 32, which will be Body, Mind, and Soul. And as I said in the very first chapter, you can't really separate them. We're going to talk about them because they're studyable in individual ways, but we are a cohesive, integrated whole. So we have the body, the physical, the chemical, the electrical body. We have emotions, we have a mind, and we have, if we don't destroy it, a connection with our soul and ultimately the God force.
Right. So what I've heard is that when there's distress or when there's not harmony in the soul, it eventually ends up in the body. Do you feel there's like an order like that? Is that
I do. I think, I look at the soul as the puppeteer. The puppeteer is trying to coax us with conscience to do something. But if we don't pay attention to that, then we begin to get out of control. I think Pinocchio is a perfect allegory of the connection between the soul and the mind and body. And so we forget that we are ultimately responsible for ourselves. And we need to pay attention to those things that are going to take care of us so that we can carry out the number one, in my opinion, reason for being alive, to help other people.
is service?
Service. But if we are agitated and wanting and needy for ourselves, then we don't have the energy to do that. It's that simple.
Right. As Carolyn May says, it's like, get over yourself. Who do you think you are? Just ask to be shown the truth and to be in service. Because it's our egos. We become so self-important that we don't hear the message.
Exactly.
And it is about service and love.
Absolutely.
So these oils affect mind, body, soul.
Exactly.
Right?
They help energetically put us back in order. They help organize the electricity and the chemistry of the body so that we can function more effectively.
Can you talk about the oils, what they do, and then how you would use them in combination?
Right. Air Bliss is for a circuit in the body. It's 13 specific acupuncture points that, first of all, raise oxytocin and neurotensin. Neurotensin is a neuroleptic that we naturally produce. And a neuroleptic is primarily what I would call for detachment. Who cares? But oxytocin is for caring. It is the bonding, nurturing love hormone, and even called the moral molecule.
Wow.
And so this calms the savage beast, so to speak. And you just rub it on. And this is not one of the points, but here's how long it takes. That's one point.
2 seconds, right, you said.
Yeah. And then you start at the toe, and you come up the body.
And it's
toes here, bottom of the spine, these 2, 3 back here, and that one.
And by the way, they come with instructions, and there's online instructions. It's
Yes.
super easy. So that's your number one. That's
It's the
feel
most
good, it's
important.
balancing, okay.
Because it's excellent for depression and anxiety. Interestingly, by the way, for menopausal symptoms in women as well.
And people can expect to see results either immediately or it could take...
Within a day or two.
Wow, it's incredible.
Fire, actually, when I was developing the circuits way back, it was the first circuit, but it was the second oil that I produced. This raises dehydroepiandrosterone, or DHEA, which basically is sometimes called the mother hormone, but it is the #1 hormone for knowing whether you're handling stress well.
So DHEA, you talk about that a lot.
Yes.
So is this alone used to raise it, or are there other things?
Well, there are other things that can raise DHEA. DHEA ordinarily is there to balance cortisone. I call it the dance between cortisone and DHEA. We reach in our growth at age 25 average a maximum production of DHEA. By age 30, most people have lost 10% of what they had at age 25 because of stress. By age 80, they've lost 90% of what they had at age 30 because of stress. So this will, on the Ring of Fire, with 12 points, and the only one that has 12 points, by the way, it will raise DHEA. Now, it'll do it within a half hour, but it won't last unless you do it every day.
So if you do this every day, will it increase? Will it keep
For about 3
rising?
months, it reaches a peak.
Right.
Average 60% increase over what you started with.
My God, that's incredible.
If we add magnesium lotion to it, that's another 60%.
Stuff should be on the
Come to
black
that.
market. This is it. Oh, by the way, I mean, not to totally digress, but this, I am addicted to this magnesium lotion. As Norm says, you just squeeze a couple tablespoons in your hand, rub it on your butt, and it's transdermal. It gets into your cells. And the magnesium tests, you said, really are not accurate, right?
The blood test is
the
not
blood
accurate.
tests are
The
not accurate.
intracellular test is.
Intracellular.
Where you scrape under the tongue and send it off to Intracellular Diagnostics in Medford, Oregon.
But this is one of the mother minerals. It's so essential,
Oh, yeah.
and you feel so
And
good.
it is deficient in 80% of people.
Right.
Because of stress. So when you're stressed and raise adrenaline, it actually causes you to lose magnesium in your urine. But at any rate, this not only raises DHEA, it gives you energy. 80% of people with diabetic neuropathy, damaged, painful feet. 70% of people with rheumatoid arthritis who have failed to respond to drugs. 70% of people with depression. This is 80%. This is 70% for depression. And 70% of people with low back pain improve with
Really?
this.
And would you use them together? You do, right?
Yes, often.
There's no downside to using them together.
No. We'll talk about an upside in a bit.
Okay.
But that one is, to me, second important. Probably the third most important is Earth. This raises calcitonin. It raises your calcitonin, not some salmon. And calcitonin is the hormone that keeps your bones strong, so osteoporosis. But also it is 40 to 60 times as powerful as morphine in reducing pain. So it's tremendously important for pain.
This is such important information.
Yes.
So you have studied and you've seen
We've
people's
proven
pain.
this.
You've proven that this reduces pain
Exactly.
by 80%. I hope you're selling a lot of this, are you?
Oh yeah.
Good, good.
And of course then there is water. Water is interesting. It normalizes aldosterone. Aldosterone is an adrenal hormone that balances water and potassium. So its primary need is for people who have emotional imbalance in general, not just, one thing or another, but just, if you will,
A little
scattered.
scattered, I was going to say.
And edema, swelling.
That helps edema?
Edema. One young man who had legs about that big from congenital lymphedema. Took a month, and the first time in his life had normal legs.
So it's affecting the water element, which is the kidney, which is the whole water balance.
Exactly.
Wow.
And then finally, crystal. Crystal reduces free radical production 80%. I know of nothing that comes close to that in reducing free radical
Can you
production.
talk about, for a second, free radicals?
Free radicals are chemicals in your body that get over-oxidized, if you will. So you've got, it's like having ozone run around in your body grabbing for something. And free radicals ultimately, essentially rust our bodies. They cause wrinkling, they cause damage to cells, and ultimately death. They wear us out. And although antioxidants like vitamin C and vitamin E and vitamin A are good, huge doses of those do not reduce free radicals the way Crystal Bliss does. Now this takes 2 to 4 weeks.
Okay, well, we can live with that.
In 2 weeks, you can reduce your free radicals by 40%. In a month, 80%. And as long as you keep it, it will keep your free radicals down. Long term, 80%.
Wow. So the combo deal, we have all of these. If you had to say, because really what I want people to know, what are the essentials for health? We'll start with the oils. Like, what are the ones they should use just across the board together?
Well, it depends on whether you have any problems at all. If you have no problems, you don't need to think about it. Once you've got a problem, you might choose one or the other. Now, my original idea back in 2005, before I had the oils, was that, if we could keep our DHEA up and our calcitonin up and our free radicals down, just those three, we ought to live 140 years. I wrote the book.
Live to 120, yeah, right.
120 to 100, plus or minus 20, so 120 to 160. But to do it with electricity, which is all we had back in 2005, would take an hour a day. And so I knew people wouldn't do it. So that takes us into electricity, which I've worked with for 60 years. Basically, human DNA, every cell, resonates at 52 to 78 billion cycles per second. We never lose that frequency as long as we're alive, but we lose voltage or amperage. In other words, it's like a motor or a battery that's running down. George Lakhovsky, back in the 20s, discovered that human DNA was 50 plus gigahertz. Giga means billions. And he exposed people to these frequencies and had all kinds of results. So
They were healing from all diseases.
all kinds of diseases, exactly. Because basically he's restoring the voltage, if you will, in your cells. So starting in 2006, I began exposing the body as a whole to 52 to 78 billion cycles per second at a billionth of a watt per centimeter square. And the only way to do that comfortably was to make a mattress. So we made a 2-inch thick mattress, in the center of which is this copper screen, on which is 1 pound of crushed sapphire crystal. Wire comes out, hooked to Tesla coil, and that produces a 2.5, 3 foot deep field, and the body absorbs it. So you need it 30 to 60 minutes a day. And the first 3 years, my telomeres, which ordinarily shrink 1% a year if you've got good health habits, my telomeres grew 12%, 4% a year. And meanwhile, I started 35 other people using this 30 to 60 minutes a day, and the average person was growing between 3 and 4% a year. Then, my wife became critically ill, and over a period of 13 months died. Those 2 years, I lost 12%. I didn't lose what
Are you still going on the...
I was still doing the Rejuvenatrix.
So what does that say? So you lost because of stress and the
stress
grief
is hard to handle.
Right.
But I continued, and so over the next couple of years then, between 2011 and 2013, my telomeres rebounded and grew 15%. So I caught up again. And so in April of 1 year ago, I decided to switch to the oils to see if that would do as good a job. And so I switched to all 5 every day. It takes 2.5 minutes a day. My telomeres grew another 4.4%. 3 of my other subjects who wanted to, because they travel a lot and other reasons, wanted to find a way, they used only fire, earth, and crystal, because that was my original idea. One of them grew 2.6%, one grew 3.5%, and one grew 9.9%.
Wow.
So I started another 15 people this June and July on using all 5 of the oils, and we've measured their basic, and we'll know in a year how many, what percentage of people are going to get good results from telomeres. But at this point, we could say at least using 3, maybe 5 of the oils, you can not only stop the shrinkage of your telomeres, but rejuvenate them.
So telomeres are correlated with longevity and health and
Telomeres
vibrancy.
are the #1 measurement we have. It will tell you how long you're going to live, basically. And the longer they are, in general, the longer they are, the healthier you are, the longer you're going to live.
I don't know about you guys, but when I've studied all of this, I am on all of these oils right away, because why not? There's no downside.
I don't know of any downside. Now,
That we know, right.
Right. I have to say, I think, people who are sensitive, there are people who are sensitive as well. I know one person only out of a few thousand who got a migraine sniffing the oils.
Really?
But I've got scores of migraineurs who treat their migraine using the oil. So, so we're all unique individuals. I think it's critically important to smell them first if you're highly sensitive to odors especially. But other than that, I haven't seen a problem. I have just hundreds and hundreds of anecdotal reports of people helping themselves
Who are
with
healing.
everything.
So I want to finish just the physical part of the body. It's kind of like Norm's top 10. We know that you say smoking is one of the worst possible things.
Of course.
You can do. That's like a no-brainer.
I tell people who smoke, I don't have anything as strong as the poison you're taking.
Is there any way to repair if people have been smokers?
Yes, if they quit.
That's it?
Yeah. I mean, just quitting. But of
Right.
course, there are antioxidants that can help repair as well. But if you quit, within 10 years, your life expectancy is repaired to essentially someone who never smoked. If you make it for 10
It
years.
is, because my dad, who just passed away thanks to the medical establishment botching something, but he passed away at 98 and he quit smoking at 42.
Sure.
So there you go.
My father, unfortunately, did not quit smoking after his first heart attack and died at 53.
There you go.
And 5 of 6 brothers in his family died between 48 and 54, all smoking. Brother number 6 lived to be 80.
So quit smoking, that's number 1, but
Number
that's a
1.
no-brainer.
Number 2 is keep your weight normal. Normal means body mass index 18 to 24. Every one above 24 that you get increases your risk. By the time you get to a body mass index of 30, which is a minimum of 40 pounds overweight, no matter what your height,
Right.
when you're 40 pounds or more overweight, your life expectancy is the same as someone who smokes 3 packs a day.
Really?
Yeah.
And does it matter the ratio of fat to muscle, or it's just more, is that the BMI, is that fat muscle?
Well, very few people are overweight because of muscle.
Right.
It
And I
happens.
mean skinny people that don't have muscle, is there a correlation with that or not really?
No, you don't have to have a lot of muscle to.
Okay,
as
so
long
it's
as
the
you're
BMI.
not-
So
Right.
smoking BMI, movement, exercise. I saw your bouncing thing. If people can't work out, I love it. You said once an hour, you stand up and you just
Bounce for 3 minutes.
Not on a rebound, but bounce. Can you show us?
That's it. You know?
Can you imagine just stop every hour and do it for... are you gonna
3
do it
minutes.
3 minutes.
Build up to 3 minutes every hour. halitosis is better, no breath at all.
Right.
And so, 30 minutes is the minimum 5 days a week.
Right. Now, I came here this morning, and you said, and it really, I feel I have shame, that you exercise for 2 hours. What do you do for 2 hours?
Well, let's see. I start off with 25 to 30 minutes of yoga and limbering. Then I did 15 minutes on a health rider, which is a low-slung bicycle where the seat moves, the handlebars move, with 35 pounds of weight and 100% oxygen at 100 liters per minute. And I'm doing that like this.
Oh, you have the oxygen machine
Oh,
hooked
I've
up.
got a mask on with oxygen.
Oh, it's a mask, not
Yeah.
even the nebula.
No,
okay.
no, it's heavy duty. I am totally sweating within 5 minutes.
Wow.
I mean, it's phenomenal.
And people can do this at home.
Oh yeah, well, I do it at home.
Yeah. Well, you're
then I get in a 5-foot deep hot tub, and I stand there fast as I
And in the
can
hot tub.
for 25 minutes.
5 feet. That's so interesting. So, because you're
I
not
took,
running.
I took a shower first to get in the hot tub, of course,
That's-
and then I do 30 more minutes of limbering.
Wow. And you feel, you're, can I say your age now?
82.
You're
Of course.
82 years young. Honestly, I'm exhausted already. So I'm.
Well, that's my average pattern.
Amazing
I might
energy.
do a few more things during the day, but my beginning,
But you said that minimum 30 minutes of some kind of movement
yes.
is going to increase your health and your longevity. Okay.
And then number 4,
Yes. Number 4.
a minimum of 5 servings a day of fruits and vegetables combined.
Organic if possible.
And I start my day with 5 servings of fruits and vegetables and a slush
In a smoothie.
in a smoothie. So I have 3 fruits and 2 vegetables in a smoothie to start the day. So I've had my 5 minimum.
Okay.
Then I'll get 1 or 2 more at lunch, maybe have 1 in between, maybe 1 in between, and then 1 or 2 at night.
Do you put any green powders in? Do you do any of that? Or what's your protein?
Well, spinach, actually dried spinach is the greenie that I use.
Okay.
But it can be something else sometimes.
And what's your feeling about protein? Is it?
I have, in my slush, I have 24 grams of whey protein isolate.
Okay.
So I've started my day with some of the best quality protein there is, whey protein isolate.
Is there a brand that you like?
Well, I use
now.
Now. If the
Now,
company
okay.
NOW makes it, I like them because they're a good quality company and they're less expensive than some of the others.
Do you believe in the blood type diet? Or?
No, I think it's nonsense.
Me too. I have to say I do because it was based on something that was a gazillion years ago. And
Yeah, and I'm A positive, and theoretically I should be a vegan. Back in 1971, I decided to try veganism. Whew, I thought I'd die.
Didn't like it.
I kept it up for 15 months, and I had to quit. I had no energy.
It wasn't right. And this
No.
is the thing, like, we are so individual
Exactly.
that we have to be treated that way.
And 100% of vegans, unless they take B12,
Or deficient.
will wind up B12 deficient and taurine deficient frequently, because taurine is found only a little bit in one vegetable product, which is marijuana seeds,
Really?
hemp heart.
Let me ask you this while we're on that now. Hemp and marijuana, just quick.
I just personally
Assessment.
am not interested in it.
Okay.
I know there may be some benefits. I'm aware of that. I'm also aware that marijuana destroys the frontal lobes.
It does.
It's
There's been
what I
pictures
call a
of
frontal
lobes.
lobotomy chemically.
Right. And you're a neurosurgeon.
I happen to like
Gabriel
my
Cousins
brain.
was there and showed there were holes, and people said it's the AMA. I don't buy it. I think you like your prone brain. Yeah, it's important.
Yeah, I really like my brain, and I don't want to damage it.
Okay, so now, what supplements do you feel are essential?
Now you're talking about for average people
I'm talking
or fanatics
average.
like me.
Well, I think you're average, actually, because we're living in this world, and we have to deal with all the EMFs and GMOs and all this stuff, so.
Yeah, chemical pollution. Fortunately, for 46 years now, I've lived on a farm.
Yeah.
I have my own water. Because to me, the number one poison that affects everybody more than any other
It's water.
is chlorine and fluoride.
So going to that then, you have to have a system to
Get rid of
just
it.
to get rid of that. You have to have some filtration system. What do you recommend?
Well, if I lived in a town, I would want a whole house system.
Right.
Because I don't want to be bathing in it. But especially, I don't want to drink it and brush my teeth with it and that sort of stuff. Fluoride is a poison. Period. I could go into. Chlorine's a poison. The first weapon of mass destruction, World War I. Chlorine gas. And so there's good evidence that both of them are damaging to our health and life.
And the dentists are still using fluoride.
I know, I consider the
What's going
dentists as
on with
evil
that?
as the tobacco
That's
industry.
crazy.
They're still using mercury.
I mean, your kids should not have any fluoride treatments. It's so damaging to their immune system.
And their brain.
Bones and their
Long
brain.
term, yeah.
Wow.
Okay, so that's
Okay, so-
at the beginning. I believe that everybody should be taking a minimum, as an adult, 25 milligrams of a B complex with some trace elements.
Okay, I want to ask you then, what about, are there people that you believe have a methylation deficiency and then should it be methylated?
Unequivocally, methylfolate and methylcobalamin and B12. I come from a family where I know that my grandmother and my mother, same family, my mother's mother, both were B12 deficient in their older age. They had to take B12 shots. I take methylcobalamin sublingual every day, even though I eat lots of meat, because I don't want to get there. In fact, finally this summer I actually had my B12 level. It was sort of twice the upper limit of normal. So I'm not worried about B12 deficiency, and I don't know whether I would have it.
Right, because there are a lot of people, I found out that I had 2 genetic whammies with this methylation thing, and that affects your whole system.
And then of course folate. Now back in the 70s, Kurt Oster learned that some people needed as much as 80 milligrams of folic acid to function properly. Of course, that was before methylfolate.
And that affects depression and your whole sense of well-being.
Blood,
This is like
everything.
a big thing, yeah.
It's a total body thing. So I think people should have checked, not later than age 30, they should have a homocysteine blood level. Because if your homocysteine is above 7.5, you are at great risk of heart disease, stroke, cancer, and early death. And the average cardiologist is ignorant.
And they tell you if it's 12, it's fine, for them it's fine.
I recently saw a cardiologist who had a number of symptoms, and his homocysteine was almost 15. He hadn't even had it checked.
So what brings it down, the methyl Bs?
Methylfolate,
Right.
methylcobalamin, and vitamin C will bring it down. So I think everybody should take at least 2 grams of vitamin C. Now, if they take that with a gram of methylsulfonylmethane, it will help raise DHEA.
So what is that thing you just said? What is it?
Methylsulfonyl, MSM.
Okay,
It's known
thank
as
you.
MSM.
Okay, MSM, okay.
And so I put that together in my youth formula because
Oh, great.
that will raise DHEA an average of 60%.
So your youth formula, I was going to ask you that, along with these oils, will
Right.
help to raise the
DHEA.
DHEA. Okay, that's important.
Yeah, and you can take all the MSM in the world, all the vitamin C in the world, it won't raise DHEA unless you take them together.
Wow. Important. So important.
Oh yeah. And so I think then everybody needs one of the best, and the best in my opinion, vitamin A family is astaxanthin. ASTAXANTHIN.
Can you take too much of that? It's fat soluble or?
Yeah, but 10 milligrams a day for the
That's
average
okay,
person.
that's
yeah.
fine.
It's great for your skin. It helps to prevent sunburn. I haven't ever used a sunblocker. I don't believe we should use sunblockers. Now,
Right, well, that's a vitamin D then. This
and
whole
then,
big-
but because of overall stress, if you won't take anything but one, I would take vitamin D3.
Okay.
50,000 units once a week.
With the K2, I was told you need...
K2 is wonderful. If you're healthy, don't have any problems, you might get by with 100 micrograms. But if you have any problem, any, then you except, well, there's one exception. You need 15 milligrams of vitamin K2.
So there are some supplements with D3K2, and that's okay?
Yes.
Okay.
But if you've got, in my opinion, the only contraindication will be if you've been put on warfarin, rat poison, to keep your blood from clotting. Then you can't take
Rat poison, okay.
K2.
So that's the supplements that you think are just essential. Now, I'm going to fire you up. Going to the subject of these very common medications that people are on, the statins, the Lipitor, the antidepressants, can we just briefly touch on the harm they're causing and how they're not necessary?
Well, first of all, I would not take a statin drug for $1 trillion. I used to say billion, but you know, now it's important to emphasize it. Statin drugs are damaging above everything long-term to your memory and your brain. But they damage your liver, your kidneys, your pancreas, your peripheral nerves, your heart muscle, your peripheral muscles, and your brain.
Do you hear this?
And they're not necessary.
So instead of that,
If you have a cholesterol problem, then I would start with beta-sitosterol, 400 milligrams with each meal. It works for a lot of people.
I also heard that this whole hype with the cholesterol, it's not really necessarily that accurate.
Well, it isn't, but there is evidence that when it's above 200, it is somewhat risky. So I would like it to be between 160 and 190, ideally.
Okay.
Now, by the way, there are people pushing to get it below 150 now. That's dangerous to your brain also. Your immune system's damaged, your brain's damaged. But I would bite your hand off rather than take a statin drug.
Okay.
I consider them the probably overall most poisonous, widely used drug.
So do people need to wean off it? Or
Yes.
They do.
Should do it over a period of a month.
Okay.
And lecithin granules are also excellent, 2 heaping tablespoons twice a day. They help regulate cholesterol, they help your memory, they're good for making acetylcholine. It's a good combo. And there are other things, there are lots of other possibilities if you need to lower cholesterol. You can go to my website.
There's
and-
information on your website, and apart from people coming here as patients, do you ever do patient Skype sessions or no? Do you ever work with people distance?
Well, starting in January.
You will be?
I will be.
Yeah, 'cause that's so great.
Okay, so that's that. Now, the next category of drugs that I consider horrible and beyond useless is antidepressants. First of all, they don't work. They do, to some people, make them less deeply depressed, but they never make you feel great. And long term, they're very damaging. And in men, they're one of the number 1 or 2 causes of erectile dysfunction. And they markedly increase the risk of suicide at all ages. At all ages.
So again, the oils are something that people can wean themselves off, probably after being on them for a couple months, right? To kind of get a balanced levels of things.
I start if I'm managing them within a week or 2, but slowly.
So under supervision, we're not recommending any of this be done without a medical
Exactly.
doctor's supervision unless you just want to do it.
A third category that is really nonsense is antihypertensives.
Right.
Even with taking 3 antihypertensive drugs, less than about 45% of people have their blood pressure controlled well. That's hardly better than placebo. With 3 drugs, which universally almost cause fatigue and erectile dysfunction. I can control hypertension at least 99% of the time, without drugs.
Are there any drugs that you feel have a place? Maybe that's a better way. I mean, including aspirin.
Well, yeah, aspirin can be helpful. It's better, I think, than most of the others. By the way, Tylenol I consider one of the worst drugs in the world. It doesn't have much help at all for pain, and it damages
Destroys
your liver. Yeah, antibiotics in acute, if you've got acute bacterial meningitis, it can save your life.
Right.
If you've got congestive heart failure, there are drugs that sometimes can help immensely. People who've got severe endocrine dysfunctions, for instance, hypothyroidism, it is perhaps one of the most controllable things. Armour's thyroid, of course, is my preference rather than synthetic stuff. So, yeah, there are some drugs that can be, in general, in acute illnesses, drugs may be appropriate. Rarely, in my opinion, are they appropriate for chronic problems.
Your patients will be treated with alternative modalities and treatments as opposed to going into medication.
Exactly.
So,
Again, narcotics in acute pain, wonderful, definitely.
but you
After
would
a
also
month,
use... you would
under
also
no
use
circumstance.
oils, right.
Under no circumstance should narcotics be used unless you're dying of cancer.
Right.
But other than that, there's no circumstance for using narcotics after a month, in my opinion.
Thanks so much, Norm.
Blessings.